This patient suffers from spasticity of the muscles. She's had a bad injury, and as a result of that, she's unable to use the arm very much. We'll have to give her some sedation, but this procedure can be very uncomfortable in some cases. In many cases, it's not. Every patient is different, but she's had somewhat of a difficult experience with her pain already for the last 8 months or so. So we need to be very careful to make sure that we inject the area, but also in a sedated environment. She's still awake, she's still able to communicate with us and let us know what she's feeling as we're doing the procedure. Now, this must be done in a sterile technique. We will use a specialized needle to do each of the injections. We want to identify the muscle of spasm. Generally, it's done by feeling the area and feeling the area of spasm before you advance the needle into this proper location. Once it's there, we'll inject the medication. We'll get an auditory signal, a little wire coming off the needle is telling us when we're in the muscle that's causing the actual firing, indicating that the muscle itself is having some spasm. And quite simply, by asking her to move the muscle against resistance will allow us to get this signal, identify the signal before we proceed with the injection. There's risk, like in many procedures, there's risk of injecting into a nerve, into a major blood vessel, and even into the lungs. So we make sure we're very careful when we do this injection, not to go too deeply into the area, palpating the muscle and feeling the injection as you go into the muscle itself. In most cases, Botox has an effect in 2 to 3 days. It may take up to 2 weeks to see the maximum effect. This may last up to 3 months or even longer in some cases. In this case, she did extremely well and did not require another injection.